Hello and welcome to our channel. Today we have with us Dr. Cliff Tao, who is a chiropractic radiologist. We are so fortunate to have him with us today. We're going to be talking about the importance of having second opinion readings on x-rays that all kinds of many different providers take. Dr. Cliff Tao was born in Ottawa, Canada. He now lives in Irvine, California. He's operated nationwide private chiropractic radiology practices since 2004. He went to National University of Health Sciences in Chicago. He completed a 3-year full-time chiropractic radiology residency and a fellowship as well at University of California in Irvine Medical Center in Orange, California. He's an internationally sought-after speaker and has both published chiropractic and medical literature on topics of chiropractic spine, musculoskeletal imaging. Dr. Tao was a former voluntary radiologist, faculty at LACC, and former voluntary instructor of radiology at UCI Medical Center in California. He's married and he has an 8-year-old boy. Enjoys the outdoors, especially downhill skiing. So I'm really honored that you have come today to speak with us and teach us and inform us and shed light on a lot of important topics, especially in the personal injury form. I actually found you through a few chiropractors that had told me to get a second opinion reading on my x-rays. And at first I thought of it, and then we spoke, and I said, this is something that I need to do, because having two sets of eyes look at a film, you're going to more likely than not be, I should say, less likely to miss something. So for me, I didn't want to miss anything on my patients. I wanted to make sure that I was documenting as much as I could about the patient's injuries on film. And as a chiropractor and even primary care providers, medical doctors, we have a limited x-ray experience and basis. We haven't done a radiology fellowship. We haven't done a residency and then fellowship. We haven't done those things. So for me, it's been great having you do second opinion readings for our patients. And we actually will talk about it today. And you found things on, especially one of my patients, that I think would have been probably overlooked by most chiropractors. So with that, thank you for being here. And I wanted to ask you this. What do you think is overlooked by most chiropractors and most primary care providers regarding x-ray and other imaging that you guys have been very helpful in finding and identifying?
Well, Dr. Selinger, first, thanks for having me. I feel extra special today being your guest. It's not often that I get to do this. So your question, what's a common thing that might be missed by a typical chiro or even a primary care physician? And I'm thinking, specifically within the personal injury realm. I think it's the antero and retrolisthesis measurements. I think a lot of people, it's not that they never heard of it or just can't do it. I think maybe they're just not educated enough or haven't heard of the value that it can bring, and then to have a good attorney to know what to do with that information. So, because in addition to reading your x-rays, which has been great, thank you. We do a lot of second opinions that are not taken at chiro offices. So they've been done maybe at a different chiro office or done at an imaging center, and the report has been, not so great maybe, or they lost the report or something and they can't get it. And when we do have the report, we see it, and we see and it's not uncommon, unfortunately, that we see things that are relevant that are missing too on the report. And especially in a personal injury case, it could make a big difference.
Mhm.
So yeah, I think that's unfortunately a common thing that we see, at least in our practice experience, that's kind of overlooked.
So what you're referring to is on the flexion, extension, cervical or neck films, when the head is in flexion and extension on those x-rays, you're finding that there's some slippage, or it looks like there's too much movement of those bones due to a ligament injury from a car accident. And is that what you're
Yeah.
referring to?
Yeah, cervical flex extension. We do lumbars too,
Lumbar
but
too.
I'd say probably 90-95% of them are cervicals, of the ones that we do. And yeah, that we'll see clearly that it's moving anterior too much or posterior too much or both. And it wasn't really mentioned in the original report. So we mention them. We don't imply causation because we don't have the full picture, but we will say, oh, this is ligament laxity or instability. If it, as you know, if it's more than 3.5 millimeters in the adult cervical spine, then we put that in the report.
Right. And from your experience then and knowledge, that can also affect the impairment ratings or the long-term prognosis or of the patient if they have those ligament injuries. And if we know that the patient has those injuries and we have it on x-ray, then it's easy for us to, one, make sure that we're doing the right treatment, and we're documenting that, and in order to help the patient best identify what's wrong, and then have a treatment plan to be able to help them recover or get back to as best they can.
Hmm. Yeah, yeah, I think it does affect, of course, how you're going to treat and manage them. And then even in cases where, maybe you didn't do that flexion extension in the beginning, or you did and maybe it wasn't measured, so you couldn't see the extent of ligament laxity. And now, whatever, 6 months later, and the patient isn't really getting any better, um, go back and look at those x-rays, see if that maybe is a reason why there's a kind of a longer prognosis to the case.
Right. And in a lot of cases too, I know lots of chiropractors and attorneys as well. If we document those findings on x-ray, it's just easier and more, it's better, one, because the patient, of course, knows what's wrong. But when dealing with insurance carriers too, we can better explain to them what's going on with the patient, and why the justification for additional treatment, because ligaments can take a lot longer to heal and recover from a ligament injury versus just a more muscular injury. So that's, I think, very important for the patient, and important also for us to be able to communicate that and have that on our notes, to make sure that that's being documented, and to be able to provide the best or the proper amount of care rather than just 10 visits and they're done. There's now something that substantiates the type of treatment plan that we have, um, and that we want to do.
Yeah, and you reminded me of something, Dr. Selinger. It's not that well, I mean, maybe I'd like to say our reports are a little more more thorough or more focused. And like you said, this is all we do. We don't even allow patients in our office. We don't talk to them. Well, all we want to look at are pictures of X-rays, and I think I mean, you're a very busy guy, Dr. Selinger. You got to treat patients, you got to take care of your staff, your office. We have a pretty simple job here, but we're hyper focused on imaging here. And I feel like, when we do that, we can knock out all the findings and, some people have said, when they send their x-rays to us, or other imaging, and they're like, do you want us to tell you, a history or something? And I'm like, yeah, give us a little bit of information just so we know what to focus on. But they were withholding it because they thought it would bias us. But we, like you said, we went through a residency. It was 3 years long. All DAC bars go through a 3-year residency. And one of the things they hammer into our heads repeatedly is to not let that stuff bias us. So one exercise, and I think this is good. I know it takes a little bit longer, but I think it's good training if you're looking at your own x-rays, is to kind of look at them twice. Um, and it doesn't mean there's a little bit more to it than that, but the first time you look at it, you kind of have to just look at the picture and forget about, what the patient came in for, when their injury was, who's paying for their services, for your services. Just look at the picture for what it is. And I think that'll force you to look at everything, kind of commit to certain findings that you see on the x-ray. And then when you look at it the second time, reinsert that information back in your head. Oh, they got pain around C4-5, they got arm pain, and they, had an accident just 6 days ago. And then it kind of focuses you in a little bit more. And so we did that repeatedly, thousands, tens of thousands of times. And I think that gives you a better look. So you get a good objective, but also good subjective report that way. And I think doing that gives you, the clinician, the best information that you can use to help, kind of custom tailor your treatment plan and come up with the best thing for the case.
Great. Okay. I want to stop right now and take a quick commercial break.
Want more certainty with your x-rays? Want to streamline your workflow more so you can see more patients? Or just want to limit your liability with x-rays? Get a second opinion. Dr. Cliff Tao is a chiropractic radiologist and reads diagnostic imaging studies for all chiropractors. His professional, highly detailed reports are provided next business day with stat reports available same day. Head to clifftaodcdacbr.com for more information. That's Cliff Tao, TAODCDACBR.com today. You can also find us on Facebook and LinkedIn.
I'll just quickly show how we do our measurements. Another important thing is to have the right software. I mean, I'm a big proponent of working smarter and not necessarily harder. And having the right software, we can easily, zoom in and out and change the density and the contrast, like I'm showing you here, is invaluable. Especially when if you're reading a lot of x-rays and you're time constrained, and being able to measure them easily. So here you can already see, just eyeballing it at C4, C5, you could see C4 moved anterior a little bit. And so we measure it like that. I mean, that's probably not super exact. And you can see the measurement is to the 100th of a millimeter.
Wow.
I don't believe we can measure that closely. I don't know if you can see that. It's pretty small. It says 2.06. And so normally when I report them, I'll report them to the 10th of a millimeter. And I think that, kind of makes it look like it's more accurate. But that's what we report, because we want to try to be as specific and as accurate as possible. And then here you can see on the extension view, there's a little bit of retrolisthesis at 3-4. So we would measure here. And the way we measure is important too. We measure the measurement technique as they have outlined in the AMA guidelines. And so if anyone questions, why are we measuring this way or, not another way? We're like, well, that's the way that's outlined in the AMA guides. That there's no, it's pretty plain and simple. I used to have a little picture of it somewhere that I could show you, but you must, I imagine you have it too, but it's a pretty good resource to have. So here at C4-5, you can see I measured about 2.1 millimeters anterior in flexion, and then maybe 1.3 millimeters, goes 1.3 millimeter posterior in extension, So we add those. So that would come up with 3.4. Did I do math? It helps to know math. 3.4 millimeters. Oh, so that's actually pretty significant. We'd say moderate ligament laxity at that point. Not quite instability, but that's a lot of moving around to consider, especially if you're going to be adjusting them or giving them the right exercises to do.
Right. So, yeah, and this is another thing that with another point you're bringing up, your software and your technique, most chiropractors are not going to have this type of software to be able to do these measurements like this. And it, in a busy practice, it would just be very difficult to do on many patients. So having this and then getting it in a report documented is why I like working with you. So we want to make sure that we're recording and documenting this type of ligament injury in the spine.
Yeah, it's I don't think that there's a lot of untapped resources, I think, that some chiropractors are not using, and it's unfortunately, I think it impacts patient care and how well we can get these patients back.
Well, thank you so much for being on the show today. I really appreciate it. And we'll have in the show notes below your contact information. If people want to get in touch with you, they can reach out. Again, it's been great working with you. And we've been really helping our patients a lot more with by adding on your services. Thanks a lot and have a great day.
You too. Thanks for having me.
All right.